Mr. Speaker, may I have the clerk report House Committee Substitute 1 to House Bill 529, please?
Clerk, please report.
House Committee Substitute 1 to House Bill 529.
Gentleman from Fayette.
Move for passage.
Motion is for the adoption. House Committee Substitute 1 to House Bill 529. Is there any discussion? Seeing none, those in favor signify by voting aye. Those opposed, nay. House Committee Substitute 1 is adopted. Gentleman from Fayette.
Mr. Speaker, I'm honored to rise today on behalf of House Bill 529, the Compassionate Patient Care Act. This bill is about how very impactful news reaches a patient with compassion. The bill mandates the timeline a medical provider has to contact a patient to go over lab results in a very narrow set of circumstances. Patients who may find facing a fatal diagnosis deserve a qualified health professional to help them interpret those very limited types of medical tests. This is accomplished under these narrow sets of circumstances by creating a 72-hour window for the doctor to have notice of the test results and be able to prepare the necessary advice and counsel that a patient needs. This relates only to records that could potentially show tumors or cancer or indications of severe life-altering genetic conditions. Again, this only applies to 1 to 4% of all tests that are done and gives patients access to a trained professional instead of having them turn to Dr. Google or WebMD. I appreciate the strong bipartisan support of this bill had in committee. I also appreciate the strong support this bill from the Kentucky Hospital Association and the Kentucky Medical Association. They support this bill because it focuses on serving Kentucky's patients. Mr. Speaker, this bill is incredibly significant to me personally. Yesterday morning, I had a former student of mine pass away due to ALS. He's 31 years old. His diagnosis came in November of 2021. He shared to Facebook, "Hey everyone, so I don't ever post on Facebook, but I thought this news was important enough to put it out there. Some of you may know and others may not, but a few weeks ago I was diagnosed with ALS, better known as Lou Gehrig's disease. This is a nervous system disease that weakens muscles and impacts physical function. This disease is unfortunately fatal, so I will be gaining my wings a lot sooner than most people expect to. I'm at peace with the fate of this disease, and I'm going to live the rest of my life to the fullest. As you can imagine, this is an extremely difficult time for my loved ones, as no one has expected this. So if everyone could keep my family in your thoughts and prayers through this tough time in our lives, and don't be afraid to reach out if you feel like it. I would love to hear from people. And I'm in great spirits making jokes and stuff because we cannot change the outcome of this. So I may as well enjoy the rest of my time on this earth. With all this being said, I'm going to end this long post with a quote from Joaquin Phoenix. And he said, "Run to the rescue with love, and peace will follow." There are no specific tests for ALS. There are a myriad of tests that they use to eliminate other possible ailments. Some of those tests, spinal taps, blood tests, specific radiology tests. When I think of House Bill 529, I think of how would I wanted the news to be broken to Nathan? Would I have wanted it to come in an anonymous email, cold and nondescript, with no hope or plan? Or would I have wanted him to be within the care of his doctor, who knew him from however long? The answer to that question is very simple for me. And that's why this bill is so important to me today. If there are no other questions, I move for passage.